don't, in which case it's not in their interest to have the procedure and it shouldn't be done. So they're saying it's a limited clinical need, so it's not available on the NHS, but then they advertise how you can get it and how much it will cost you. So that's a complete contradiction. On the one hand, they say you don't really need it. On the other hand, they say, yeah, but if you pay us for it, we'll do it anyway. And Warrington Hospital was one of the first NHS trusts which came out with this price list of 71 procedures. And anybody that knows the cost of these things, you know, knees over 7,000, hips over 7,000, cataracts 2,500, that's the sort of money you're talking about. And I understand, although we can't get anybody to confirm or talk about this, at the Royal Marsden now, one of the best cancer hospitals in the country, there's a two-tier system where, you know, people are offered chemotherapy, but there's two strands. One strand is, you know, basic NHS, but then there's another strand that, you know, they hint might be better. And of course you would want to do the best for your loved ones, wouldn't you? The law was changed so that NHS hospitals can go up to 49% private. The Marsden, we understand, is nearly there now. This is one of the best cancer hospitals around, but we can't get anybody to talk about it. You won't get anybody going on the record for this. And the staff there certainly won't, because they'll be pushed out and lose their jobs. But that's the sort of thing that is happening. 49% was deliberate because they can say, well, with that, most of the work of a hospital is NHS, of course, because 51% is most. But the brakes will be taken off that fairly soon, I'm sure, and the 49% will go completely.
On a happier note, we have had some successes, as I mentioned earlier on. The film mentioned TTIP, the trade deal. There was mass protest across Europe. There was a lot of protest in England, particularly in Germany. That was suspended, so that's no longer a threat. So that looked unstoppable, but that was stopped. The STPs, the Sustainability and Transformation Partnerships, basically the CUT programs across the country, they've been recently stopped or shelved in Sheffield, Southend, and quite recently in northwest London. Funny enough, one of the architects in northwest London is now the chief executive of St Helier Hospital. 38 councils across the country have openly opposed STPs, so it has having an effect. Many groups across the country, including ours, are pushing back these plans. So the more we can push them back, the more likely that they're going to crumble and collapse. So we have to do that across the country, as this is a national situation. In terms of things that we can do, I always come up with a list of suggestions, which is at the back of the hall. The most important thing you can do is obviously share the information that you've learned today. Set-off is on YouTube, so you can share that when you get home tonight, and please do. Arrange subsequent screenings yourself or public meetings, or even just small gatherings of your own. There's also the follow-up film, The Great NHS Heist, which will be out hopefully in a matter of weeks, so that will bring you bang up to date about what's happening. You don't have to join a group. Don't feel that you have to join a national group. You can actually make the change yourself. 2, 3, 4 people can put an event together. It's very simple. In fact, often they're the best campaigns, the ones that you start. Grow a campaign yourself. Don't feel that you have to follow others. Because having watched what you've seen tonight and heard what you've heard, you know a lot more than the people on the street and your councillors and GPs and MPs. So you're tooled up, and we need you to go out and do something with that information. And also, something that you can do right now is that we have a motion, so we want to take a vote. So if you agree with this, please raise your hand. This public meeting opposes the privatisation, outsourcing, cuts and closures of our health service, and calls upon the CCGs and elected officials to actively reverse and oppose them. So if anyone is in favour of that proposal or that motion, we've got your camera ready. Who's got? We need to take a photo of this. So okay.
Keep your hands up.
Yes, wait for it.
Keep your hands up.
Right. Those in favour, raise your hands. I think we need a widescreen camera. Put two hands up and cheat.
No, it's political. It's it's when politicians work. So.
I know, it's terrible. We are so political. All good? Yeah. Thank you so much for that. That's something that you can share right now. Oh yeah, anyone against? Who shouldn't be here? Anyone against, please bravely raise your hands. Put straight back down again. Did you want to? Oh, anyone abstain? Let's do this properly. Okay, 100%. Unanimous for the record. Did you want to? Thank you so much. Yes, just a few comments from Christine about the Isle of Wight, and then we will wrap up.
Thank you. Yeah, I've been running this campaign for about almost 3 years now, and it's quite frightening what's going on. But what I would say about the Isle of Wight is that we're quite unusual in some ways, in that we have one hospital, but we have a stretch of water between us and the mainland. So there's no way that they're going to be able to close accident and emergency or the hospital itself. If we got a fixed link, I could almost guarantee that our hospital would go for good. The issue on the Isle of Wight is that because of that, we don't have real specifics to latch onto and to campaign about. If your stroke unit is closing down, then you will all get out there and you'll campaign. If your A&E is closing down, you'll do the same. But what's happening on the Isle of Wight, it's happened almost insidiously, and often the only time you find out that a service has been outsourced or got rid of altogether is when you see it in the press. I have to say the press isn't very helpful on the Isle of Wight either. We've had a fairly good success rate in getting information out there, but it seems to be getting harder and harder. Ultimately, we're looking on the Isle of Wight of condensing GP surgeries down to 3 areas into what they call super hubs, and people then will have to either travel to Ryde, to Sandown or to Freshwater to access a GP if they're lucky, because like Bob says, there's not that many people going to get see a GP. It's going to be those with complex needs. Everybody else will be signposted, they call it, along a different pathway. You know, all this jargon is quite ridiculous actually, but basically they're saying you're not going to see a GP. You might see a physiotherapist or, you know, somebody.
Physician's associate.
A physician's associate, that's what I was looking for. So, I imagine that most of you have already encountered the problems getting to see a GP. They've recently signed a new contract with which Bob could probably tell you more about than I can. But basically, we have services on the island that have been outsourced. If you need dermatology, for example, you would go to the Lighthouse Clinic. Everybody thinks that's the NHS, but it isn't. It's owned by GPs on the island, and they are all shareholders. So, you know, you think you're getting that service from the NHS? No way. Physiotherapy services have been privatised. The dementia ward is being closed down, and we all know they've just spent £200,000. What are they going to do with it? They're saying they're going to signpost or redirect the patients from the dementia ward into the community, but the care isn't there, so they can't do it. So at the moment, these people with dementia are being sent to the mainland. And what about the families? How do they get any support?
Do we know about the new mental health services? Are they outsourced as well? Because about the new clinic that's been...
I think mental health is more likely to go towards the voluntary sector. Ryde is closing down. The Ryde, I forget the full name, but they've got a battle on their hands and it's going to close down. I know somebody who works for Europea, I think, and that's a voluntary organisation, and they actually do really well. But they were almost shut out from that in favour of an organisation that is based on the mainland that were going to come over and take over mental health services here. So all I'm saying is that stuff is happening, and we're not seeing it until it's too late. So everybody's got to keep a lookout, and if anybody hears of anything that's happening, we need to be telling each other. Otherwise, they're just going to get away with it, really.
Just in case you don't know about physicians' associates, because you're all going to be coming across them instead of your GP, it's the government's way of, the NHS's way of making up this shortfall of GPs or pretending there's going to be more GPs. A physician's associate, they take 2 years in training. It takes 10 years to train a GP. And they are looked at as, to doctors, what classroom assistants are to teachers. But you will be going to see these people. But it's all in the book. So I thought I'd grab the microphone and plug the book. You'll read all about it in there. So anybody who wants to buy one, come and see me afterwards. And it's only £50, but it all goes to Christine.
One more thing.
I just want to emphasise this point about de-skilling. So I'm not here saying doctor knows best, because what's happening to GPs is the work that was done by the hospital specialist is being dumped on us. The work that we used to do is being dumped on nurses. The work that the nurses used to do is being dumped on healthcare assistants. And the work the healthcare assistants used to do is just not being done by anybody, or the cynical exploitation of volunteers. The problem with downskilling is the blind spot. Yeah? So myself and Paul spent 10 years developing experience over a wide range of medicine, so we have a relatively small blind spot. The lower the experience and skill of the person you see first off, the bigger the blind spot. And what does blind spot mean? Preventable death and harm. So this is not a doctor knows best argument. All those people who are acting beyond their competence will be severely affected by the death or harm of a patient. It is traumatizing to them. Not only is the patient harmed, but you also harm the health professional, put in an unwinnable situation without the adequate training, without the adequate backup, without adequate resource. Patients, health professionals' interests are 100% aligned until we start denying care to make more money. And that's what we need to stop.
Is it worth well,
So Paul's just prompted me, the less care they give them, the more money they make. Well, the new GP contract has a shared saving scheme. That perverse incentive has quietly been sneaked into the new contract, so I will get a slice of the action if I come under budget. Do you want to be seeing doctors who are incentivized against your interest? I don't think so. And I don't want to be put in that position. I have not signed up to a network. I refuse to sign up to a network.
Well, it's kind of a question and the point that has been raised. It's very, very quick. But there's this idea that if you're wealthy and you have insurance, then somehow you'll be safe about all these measures. So Bob, do you just want to explain how that is not necessarily the case?
Or read it in here.
Read it in there as well.
What page?
If you want to appeal, I know all you here are very nice people, I can tell from your faces. But if you want to persuade your selfish, self-interested, self-obsessed, greedy neighbour why he needs to fight for the NHS, you need to tell him a couple of things. Number one, the presence of a universal safety net stops price gouging by insurers, right? Because there's always somewhere for you to go. Once you remove that alternative, where are you going to go? You're a captive customer. The second thing is, insurers will not argue if your problem is simple and cheap. If you have a hernia and you don't have complex medical problems, they'll pay out. As soon as you become expensive and complicated, Then you read your small print and you realise your budget for your cancer care is spent. Good luck, you're on your own. Go and send up a GoFundMe page. Yeah? And the most prominent example of this in the States was Joe Biden's son, Bo Biden, who was a district attorney, had the best insurance money could buy, developed a cancer, it spread to his brain. The cost of his care exceeded $1 million, insurance cut out, and he was facing the sale of his house. And at one point, President Obama offered to give some money for the treatment. Even the vice president's son is not protected in a privatized system.
So there. Okay, yes, wrapping up. Thanks everyone for coming. Please have a look at Paul's book. He's at the back and he'll be talking and signing and all that stuff. Please sign up to the newsletter if you haven't. Oh, got one more.
One more thing.
Pardon me.
At the end. Can I just say thank you so much to, well, all of you for coming, but for Christine in particular for organising, because she has been running this thing more or less single-handed for some years, at the cost of her own health.
That was on my list.
One short thing. Did you tell the county press about this? Publicity? Did you publicise that this was happening? So that
We contacted the county press and they didn't print it. I sent them a press article already done for them, and I suggested they could edit it and whatever they wanted to do. They didn't do it. I approached them a second time, and they said that they would put it on their events page over the weekend. So, we did get the information in the Observer, which isn't everybody's favourite newspaper, but it's free, so hopefully lots of people will read it. And on the Wight News, they always print our articles, so they're a good support. We also had an interview with Paul on Vectis Radio on Wednesday. I've previously done an hour-and-a-half show on Vectis Radio, but as a result of Paul's interview, we're now looking at a regular NHS slot. So listening to Vectis. I think that's about it really. Oh yeah, well, I've invited all the GPs on the island. I invited all 40 counsellors on the island. 3 were very sympathetic, and they would have come, but they got prior engagements, but they want feedback on the meeting. The rest didn't. They either had a reason for not coming or they didn't reply. And Bob Seeley, of course, who likes to call us scaremongers, I suggested that he should come and listen to an alternative point of view, because and to maybe realise that there is substance to our claims. But I got a reply from his secretary saying he couldn't come, or he wouldn't come. So that's what we've got on the island.
What I would say is that please write to the papers about what you've learned tonight and say why the elected officials aren't here. Call the radio stations. Also, we are filming this, so it's on a live stream. So if you go to the Great NHS Heist, you can share the video of this meeting. That's a good way to get the word out and shame them in for not coming. Please take the leaflets at the back of the hall. There's information. I say there's ideas of what you can do having been to this meeting. Please take a leaflet. If you can add to the collection, and please support Christine for her campaign, which is fantastic. Thanks so much for coming, spread the word, and have a good, safe trip home. Thank you very much.